So these are some important notes. I am not going to read, you read. I told you to click because all in nutshell that Hanuman wanted us to understand. Nothing else more than this. This he has applied in his cases, and this every word that is mentioned here that he has discussed in his own cases. He has given only 2 cases, and in these 2 cases he has narrated, demonstrated these points. In the solving the cases, he has written all these points. Okay. I move further. It means that when you are taking a case, you have to have all these points in mind. That affect our case taking. Exploring the case. What are the factors that come in the way or has the impression or the effect on case exploration? Okay, who are involved in the process? And patient. So obviously some factors from the physician and some factors from the patient. Sure? So it is a physician factor and patient factor. What are the physician factor, what are the patient factor that we have to experience today? So physician factor and patient factor. If we go a little further at the final level, the subjectivity of the patient, subjectivity of the physician, objectivity of the physician and objectivity of the patient. Yes? Is this point clear? What is subjectivity of the person? What is subjectivity? What patient feels. Okay. So it is a subjective perception. Subject means to own perception that is coming from the person who is giving the details. Right? If physician is taking judgment, so it is his subjective judgment. If I say something that he is not answering because he is indifferent, whatever you say, that is coming from the subject, na? Bolo. Right, very nice, very nice. Doesn't she require the applause? Very good, very good. Yes. So patient may be XYZ, but I may understand ABC. So that is my perception, right?
Yes.
Now the same thing can happen from the patient's point of view. How it will happen from the patient's point of view?
Patient may not understand the question and he answers in some
May not understand, or
he doesn't want to share her
he doesn't
privacy.
want to share. But how the subjective way of perception that will come up in the interview from the patient. Our sole purpose from taking the patient is the subjective views. That is how homeopathy is different from all other therapeutic branches. In therapeutic branches, what is happening to the person, there is not much bother, right? So the perception of the patient here, where we want to take it? Now in that, which perception we take, which we don't take. Point is that. So which perception, which subjective aspect of the patient will take?
પેશન્ટે જે ફીલ કર્યું છે જે નેગેટિવ સિમ્પટમ તરીકે જે સબ્જેક્ટે પોતે ફીલ કર્યું છે, જેમ કે આપણે કોઈ પણ ડિઝીઝ કન્ડિશન લીધી કે ફીવર, ટીબીમાં ફીવર આવે ઇવનિંગ રાઇઝ ને ફીવર નથી, તો એક નેગેટિવ સિમ્પટમ તરીકે ઇન્ડિવિજ્યુઅલાઇઝ થાય. એટલે એ પેશન્ટ સાઇડથી સબ્જેક્ટિવ ફેક્ટર થયું જે ફિઝિશિયન આવતું.
Okay. No, my question is, you have a headache. So if you have a headache, I always ask what is the type of headache. Then whatever type you narrate, I have to agree to that or not?
Yes, yes.
Because I don't understand your, when you say that torche che. Now what you understand as a torchu and what I understand as a torchu. Because મને કોઈ અલગ રીતે ટોચ્યું હોય ને તમને અલગ રીતે ટોચ્યું હોય. You don't know what is ટોચ્યું. है ना? So, but even then, physician has to have a very broader view to understand what patient has. So that subjective features, how will we understand that? We have to go further when we understand the various techniques and methods of exploring the data. It is not necessary that every answer you get at the same time. These are the points which we have to practice, and when you go out at the end of the day, you should be just subjectively feeling that I have done something, and objectively Pankaj bhai should say that yes, you have done something. So I answered you what is subjective and objective. So when patient is narrating a subjective symptom, objectively you are observing and you give value. Right? And then you understand that yes, it is matching or not. So we'll see what is the paradox of subjective and objective. We have to remove the paradox. पैराडॉक्स हम रिमूव करते हैं ना फिजिक्स में. कौन सा एक्सपेरिमेंट में? We try to understand that light is passing straight. In that experiment, now though in 12th standard nobody does the experiment only, I know. So what is the experiment? Here is a candle light. And here are cards with the hole, right? And you remove the paradox. Put the holes and candle flame in one line so that now you can see. So without removing the paradox, you cannot have the light everywhere in the life form. Not only in the experiment. We have so many paradoxes coming up in our life. Paradox is what? Why can't I see the flame? Because there is a hurdle, blocks. The board is blocking the hole. That is what exactly happening in our life, isn't it? I don't feel enlightened when there are so many blocks. I feel dark because there are so many blocks. So where are those blocks? That we have to identify. The blocks in the mind of the patient. How do I understand what is the paradox that is not allowing patient to see the light? Got it? Thank you. So there are constant and usual occurrences. Again, we are coming back to that. That subjective feeling what patient is feeling, but whether it is coming usually and whether it is a constant. Sulfur. What is a constant feature in sulfur?
Cognitiveness.
talkativeness. What is the other feature of sulfur? Dirtiness, offensiveness. All the discharges are offensive. That is constant feature of sulfur or no? Burning sensation. Is it a constant feature of sulfur or no? So these are the constant feature of sulfur. That is how I understand sulfur. The same way you will be understanding the patient who requires a sulfur. There will be consistent, constant features found in the patient. Got it? So not only it is in the Materia Medica, how we read and see Materia Medica, that we expect to happen in the patient. Factors. Some factors are inbuilt factors, innate factors, and some factors are circumstantial factors. So these factors we have to keep in mind when we will take a case. इसमें समझ में आया ना बोला inbuilt? You are born with, you are manufactured with certain features. You have brought them here or no? Your manufactured features, are you have brought here or no? Yes. कैसा है वो बंदर जैसा? वो मगरमच्छ wanted to eat ना? बंदर को बोला तेरा कलेजा खाऊंगा. जामुन जो खिलाता है वो इतना मीठा है और तू तो हर रोज खाता है. तो तू जामुन इतना मीठा खाता है, तू इतना मीठा होगा, है ना? बंदर ने क्या बोला? खा ले, खाना है, लेकिन मेरा तो कलेजा में पेट में रख के आया. So have you brought your कलेजा or no? Sure? तो मैं खाऊंगा, लेकिन मैं मगरमच्छ नहीं. See, this is the situation. Now we had enough background. Now we are facing the situations. That happens in our life. It is true for our perceptions, in our relations, our relation at family, at personal level, at social level, at our work level. It differs or not? About the same person, in your friends, you may have a different opinions about the same person. Yes? And about the same person, you may have a different perception at different time. So are you going to teach? Yeah? Even that is with the friends and our clients. Okay? With regards to patient-physician relationship, now we come to very specific relationship in patient and doctor relationship. Different outcome in the same patient by the different physicians. That happens now. That is daily, every day, when you are taking case in the OPD. And you put here one case, and there will be 5 remedies. 5 is the very minimum number I am telling. It means 5 different perceptions. Right? Okay. Now, one patient, different doctors will have a different opinion. Physician will have a different viewpoint, and a surgeon will have a different viewpoint of the same case. Right? If appendicitis goes to a physician and appendicitis goes to a surgeon, viewpoint has to be different. So is patient capricious or wicked? Patient is giving us a wrong information. That sir said in the beginning that 2 people in the same family, they give different views. they are wicked or capricious, or it is a lapse of the memory on the part of the patient. For interviewer's question, we are the culprit. We make them to understand to give answer only in a particular manner, or we make them to think only in one particular direction. So interviewer's question, though unconsciously, guide the patient to reveal or suppress the relevant information. That happens or not? We encourage to tell certain points and we discourage, or we say, okay, let us go further. And we may suppress the data. So these particular points are very important. So it is very important that we make them to reveal or we make them to suppress. And most of the time what do? We blame our patients. I am asking but he is not telling. But how are you asking so that he is not telling? Okay, so this workshop is all about that. Interviewer may emphasize different aspects. This is very important. We ask only particular aspect of the complaint. Rest of the data I am not interested in. I am interested only if you just tell me this. I am interested in getting my work done. We are most selfish people in the world. You agree? Though we are in a very humane profession, we express ourselves to be most generous, but we are most selfish. I want this one, that is all, बस मेरा काम हो गया. When I am a student, my job is, my focus is only my learning, not patient suffering. I want a case for my journal. Right? What happens patient subsequently? Do you go for the follow-up of the case and update your journal for that? So, we have to go beyond that. These influences are very powerful, though subtle and unconscious, for patient and also for the physician. I am just making you aware what happens in the process within. Without your knowledge, a lot of things are happening. And we are only responsible for creating the scenario, unconsciously or subtly. Memory plays a major role. Memory is directly proportionate to the time and circumstances, state and the purpose. Some memories remain with us and some memories may change. And they may change in a very important manner. Person's current situation strongly influences the way he regards and remembers the earlier events. देखो यहाँ में आपको situation, what a situation I am giving, pay attention. It is not theoretical. This is all coming from the practice. And a great writer. This data what I am giving you is not even from a homeopath, but it is very helpful for every clinical condition, every situation. Person's current situation strongly influence the way he regards and remembers the earlier event of his past. So whenever I am remembering my past event, it may depend upon my current scenario. You agree with that? Huh? Whatever trauma you felt at some point of time, now today when you are narrating, in today's situation, it may be having a different intensity and different effect on you. Right? Say yes or no?
Yes.
Break the silence, if not break the session. Okay. Patient, while having some serious illness or other important life stress, may describe particular events when he is ill and different events just a few weeks later when he feels better. So when I am in trouble, the way I narrate the problem and the events which I narrate, and when I am okay, alright, I am out of that situation, my narration is going to be different. Right or wrong? When you are involved in the movie, your situation may be different. There may be Ganga Jamuna running from your eyes. But when you are out and somebody says, how was it? Ah, it was okay, it was not okay. As if it has not touched you. So when you are part of it, you are in the boat, the water looks different. And when you are on the bank, water is different now. When player is playing, I am watching. I can easily say, अरे उसने ऐसे मारना चाहिए था, उसने वो करना चाहिए था. But when you are on the field, so field for the player is a different, and field for the spectator is a different, right? So that is the exact situation here. We have to understand that the patient who is narrating the complaint or the problem or a situation or a feeling, it may differ at different points of time. That is why one physician asked the question may get a different effect, and the other physician may find a different narration and the experience. Well, so many times it happens. If I take a case, patient tells me something. When I take it to Dr. Samir Bhai asks only one question and patient starts crying. And I say, she's told me everything about her quarrels and conflicts and she didn't cry. And now she's crying, making show fun in front of you. So it is all depending upon what is the situation of the patient. Now both these accounts. Now what are the two different situations I have put across? The number one is the current scenario, the circumstances gives the impact on the patient. Another one is patient's own suffering in the purpose that gives the different narration. Both these accounts may differ from what the patient had said about the same event some year or even a few months later. See, subjectively things change by intensity and by experience. That is why Hahnemann said it should be constant and usual.